Hey everyone, it's Candice Roberts. I wanted to cover microneedling with radiofrequency. So we often, this isn't a new technology, we've often heard of this for the face, the neck. We can kind of tighten the skin, resurface, we can target acne, we can target pigment, we can target general anti-aging. But what about the body? A lot of times patients come to me and they're like, look Candice, I lost this weight, or I'm postpartum, I just had a baby, and I have skin laxity. So I have a true quality issue of this skin. So I'm lacking that collagen and elastin to get that skin back thick and back tight again. It's not a fat issue, it's a laxity issue. So patients often that lose a ton of weight, they'll come to me with that lax skin right here, or postpartum, especially in the abdomen. You can put that skin together and you can see that crepiness to the skin. Also in the upper inner thighs, that's a common spot where it's summertime right now, so everybody's getting in their swimsuits and they're so self-conscious of that crepiness to their skin. Or on top of the knees as well, on top, right on top of the elbows, that's another common spot. Or in the décolleté between the breasts, that creates that cleavage, and we have a lot of times some crepiness right there. As we get older, that sun's just hitting on that area. So hello, sun damage. So how can I make that better? I do my microneedling with radiofrequency treatment. So this is actually the tip that I use for the procedure. It's 64 pins, it's gold plated. So I create the controlled injury with the microneedles. So it's little channels that I create into the skin to say, hey guys, wake up. Let's stimulate some new collagen, some new elastin, new blood flow to the area to help your body heal itself. And then that's not enough. So I want to emit radio frequency around each one of these pins. Every single pin is going to allow energy to be released from it. Also a little bit of heat. So that's going to allow contraction of the skin. So hey, guess what? More tightening right there. That's how I'm going to resurface that skin. That's how I'm going to help with tightening things up, help with any scars in the area, stretch marks in the area. We need a lot of resurfacing there. So this will cover the outermost layer and deep down underneath. I have different pins that I choose for different concerns. Sometimes I need to address the outermost layer. Sometimes I need to address very deep. It's just going to depend on that specific patient. What's good about this treatment is it's not push one button and you're done. It's push 82 buttons and then I adjust it as I go. Every time you see me, I might do different settings on you. I'm going to make it more customized to you and not just a cookie cutter treatment. I can adjust my depth. I can go from just 1 millimeter all the way down to almost 4 millimeters deep, which is pretty deep treatment. I can adjust my amount of energy. I can adjust the amount of ablation, coagulation. I'm not going to bore you with all the details, but a ton of different options on it. Downtime, guys, next to no downtime. I tell you to put some moisturizer on that area for the body parts, and you can go about your regular business. Nothing hurts too bad. You come with numbing. I let you sit with numbing for about 30 minutes before the procedure, and it's pretty comfortable. My aesthetic assistant, Danielle, blows some cool air on the treatment area as we're doing it, and yeah, the whole procedure takes about 30 minutes. So let me know if this is something you're interested in. Not everyone is a candidate, so I do need to see what area we're treating, what's the true quality of the skin, to see if you're a candidate for this or if you're a surgical candidate. Realistic expectations is definitely something that I give to you because I want you to get what's going to be best for you. All right, guys, let me know if this is something you're considering and we can do a consultation and I can help you. Y'all have a good day.